There is a new non-invasive way of detecting potential coronary blockages that involves a color-coded 3D imaging test and does not involve the kind of risks that come with more invasive procedures. We learn more from Dr. Ben Benson. He's a radiologist at Banner Imaging. Welcome to Arizona Horizon. Good to have you here.
Thank you for having me on, Ted.
You bet. This is interesting. Talk to us now about this new way to maybe identify blockages.
So as you know, the heart has multiple arteries that are feeding it. And typically, historically in the past, when it was necessary to check those arteries, there was an invasive procedure that was performed by a very highly skilled physician called an interventional cardiologist. This required a mini surgery. With advances in imaging, currently it is possible to obtain the same level and accuracy of information using non-diagnostic CT examination, which is very exciting.
And let's talk about this. This is like a color-coded 3D model. It's made of an imaging test. Quickly, the process. Keep it simple for us now.
Absolutely. So it's a volumetric assessment. Basically, they take the CT angiogram images that were obtained during the course of a coronary CTA examination for the patient, and they assess the luminal patency, which basically is the inside of the coronary arteries, to see if there is a significant blockage that requires an intervention by an interventional cardiologist. And they present that information to the cardiologist for management of the patient.
And basically what red means?
Red is bad.
Red's
blue
bad,
is
but blue's not so bad.
Yes.
But it's still, this is the potential. I mean, how accurate are these things as opposed to doing what the previous techniques were, which were more invasive?
It is extremely accurate. That's one of the major advantages of this examination. Basically, if you have an artery that does not demonstrate a hemodynamically significant focal blockage, that patient can be managed medically without the need for further invasive surgical procedures. And that is able to take care of many patients that no longer need diagnostic catheterization by an interventional cardiologist.
I was going to ask, when is this kind of test recommended? I mean, when is this the right thing to do?
It is recommended with anybody who is not in currently experiencing a heart attack, an ongoing heart attack. If somebody is currently having a problem with blockage, they would be required to be assessed by a cardiologist with that diagnostic catheterization procedure that I spoke with you about.
Yeah.
And that is where he places a small catheter either through an artery in the arm or an artery in the leg, and goes into the coronary vessels on either side, does a diagnostic angiogram, which basically is an imaging examination which shows the patency of those arteries, and if a blockage is encountered, places a stent. Now, if there is a concern for chest pain, but the cardiologist feels that the patient is not having a heart attack, or the probability of the patient having a heart attack is low and they do not have any troponins, which is another biochemical test that's used in assessment of our patients, then this exam is an excellent exam to look for a focal blockage. If a focal blockage is necessary, then a diagnostic and therapeutic catheterization will be performed. If it is clean, which many of the patients are, the patient can be managed medically, and it saves them the surgery, which is incredible.
And this is in conjunction with HeartFlow.
Correct.
Explain, please.
So HeartFlow is the company that was started by very close collaboration of imaging experts in diagnostic radiology in conjunction with our colleagues in interventional cardiology who do these catheterization procedures.
Yes.
Basically, they had this problem where they had many patients that they weren't sure if they had a blockage or not, and they would catheterize them, and it would end up being a diagnostic catheterization. They would basically put those catheters that I told you about, and they would look at the vessels, and they would be completely patent.
Yeah.
And it was a surgery that was being done because there was no other way to accurately quantify the extent of blockage for the patient. However, with this new tool, we are able to take the CTA images and give them a very accurate assessment of the coronary arteries.
Well, it's very encouraging. Dr. Ben Benson again from Banner Imaging. Encouraging news. Good to hear. Thanks for sharing the information. We appreciate it.
Thank you for having me on.